The highest number of overdose deaths happened in July, the summer months. That's according to national data. Dr. David Rzeszutko with Priority Health is here to explain why that is. Dr. Rzeszutko, thank you for joining us.
Thanks for having me.
So can extreme heat be linked to overdose deaths? So explain what's happening there.
Yeah, it very much so can. The body tolerates cold a lot better than we tolerate heat or extremes of temperature. And typically substances of abuse, regardless of the type, whether or not that's opiates, methamphetamines, even alcohol, can affect our body's regulatory systems and affect our ability to tolerate that heat and heat stress. And so it predisposes in the summer months towards problems.
So let's talk about opioids and how they affect the body's ability to handle hot weather.
Yeah, so opioids in general, all the different opiates, whether or not that's pain preparation, over-the-counter or prescription, are going to be a central nervous system depressant. So they're lowering blood pressure, lowering heart rates, affecting our body's ability to thermoregulate or to release heat from the body. And so, again, they're also going to impair our thirst mechanisms. So impair some of those systems that we typically say if we are getting impaired or into trouble, it's going to affect our ability to tolerate things like hydration status and become dehydrated.
What about methamphetamines?
Yeah, quite the opposite. So methamphetamine is kind of in that upper class, or increasing heart rate, increasing blood pressure, increasing temperature at core level. And so that, again, is going to affect our ability to just tolerate a warmer environment.
Talk about the signs of an overdose. What should people looking for?
Yeah, so overdose in general, regardless of the type of substance that we're ingesting, are going to affect either stimulant or depressant. And so rapid changes in heart rate, rapid changes in respiratory rate, or truly unconscious. Oftentimes folks become nauseated and vomit, or just completely unconscious. In those instances, it's absolutely mandatory or recommended to seek medical services and medical care. So, activating emergency medical services, calling your doctor. 911 is the recommended.
Anything else you want people to know, the steps they can do to protect themselves?
Yeah, so substances of abuse are problematic all year long, although we are talking about them with the extremes of temperature, extreme cold and extreme heat, and we certainly have that right now in Western Michigan. We're pushing 80s and 90s. And so, there's good treatment out there. At Priority Health, we do have a lot of different resources for folks to get on that abstinence journey, talk with your physician, talk with your trusted resources to do what we can to minimize your own personal risks.
Okay, Dr. Rzeszutko with Priority Health, thank you for coming on, very timely.
My pleasure.